So I wouldn't say it's normal. It's to some extent expected, but it means that something needs to be addressed, for sure. The development in osteoarthritis is pretty much universal as well. As biological beings going through time, we start to wear out our joints, and that's something of particular importance in the seniors and geriatrics, and something that we see every day, both in just general practice and then of course in physiotherapy. And that's something that can be managed. And we'll talk a little bit more about that here in a couple minutes. Other things that older dogs end up dealing with more commonly than younger dogs are things like tumors. The tumors of the bone, the musculoskeletal system, and there are some interventions, physiotherapy and non, that can be contemplated, considering the whole picture. But that's something that is unique, not necessarily exclusive, but unique to our older creatures. Cardiovascular health contributes to their aging. Endocrine and metabolic changes. These guys, as they might start to change in their endocrine system, hyperadrenocorticism or Cushing's disease. Who's heard of that? Had a dog? Known a dog?
Oh yeah.
Hypoadrenocorticism, Addison's disease. Maybe a few less of those, not quite as common. Hypothyroid. Lots of hypothyroid dogs out there. Diabetes. And I highlight those particular changes because those can translate into muscle, tendon, ligament, nerve weakness, and exercise intolerance. And so that can affect their neurologic and mobility. And those are things that we can both on the medicine side support, but then also with physiotherapy help combat. Spinal cord disorders, intervertebral disc disease, super common, both people and our pets. Going back to the neoplasia, which is another way of saying cancer. Degenerative conditions such as DM or degenerative myelopathy. Anybody heard of that? Luckily, golden retrievers aren't considered one of the poster children for this particular degenerative disorder. German shepherds, corgis, they are. And unfortunately, and fortunately, we see quite a few of them because physiotherapy is pretty much the only thing that can slow that down. And then we have to consider cognitive dysfunction that happens in the canine as well as people. And that can interfere or change the way that we interact with them in a physiotherapy program and on a day-to-day basis, for that matter. So, primary considerations in physiotherapy for the senior geriatric patient come around to pain control. These guys, as they're becoming osteoarthritic, maybe they are starting to develop compensatory issues because of the osteoarthritis. Those would be issues secondary to weight shifting. And when you're a quadruped and your gait changes and you pull weight off a certain limb, you're going to shift the way your back is now carrying weight, which is going to affect all your limbs. And so he or she may be limping on the left hip, but what you don't see is what we help you find and deal with, because they need to stay strong to be able to compensate for changes as well. So the pain control options, medications, herbs, acupuncture, laser, massage and body work, joint supplements. There's a lot that we can intervene in. Physiotherapy is a big one. Weight control. Yes?
I just wanted to go back real quick to the glucosamine chondroitin. Would you, and I know vets are always reluctant to do percentages or odds or any of that kind of stuff, but how effective are those things? Are they, are they kind of night and day kind of thing, or do you see, you know, small incremental positive results when you use those?
I would say in some patients I see more dramatic results than others. We're rarely using them alone as a magic bullet. I'm also advocating weight reduction. I'm also advocating, you know, stretches and activity modification. But anything we can do to support the joint and the joint fluid and slow down the degenerative processes, I'm all for, especially if it's not harmful. With that said, the regular supplement market is not regulated. Over-the-counter stuff's not regulated. You could be buying something that says it has a certain amount of glucosamine in it. It may not. Nobody's gonna, you know, police the supplements. And it might have the amount of glucosamine or chondroitin in it, but is it a bioavailable form? So it can be a bit of a gamble when you're just kind of choosing stuff at, you know, Costco or whatever. So if you're real serious about it and you want to not kind of, you know, waste your money and get any potential strong benefit out of it, you're going to want to use something that has actually been tested and has somebody governing, you know, its quality, which you usually end up having to use something that is available through veterinarians. I tend to have confidence in the Nutramax line. They have a lot of research, and it's not cheap stuff, I'm not gonna lie, but at least you're not wasting your money, and you're getting your benefit.
Along the lines, thank you, of glucosamine chondroitin with MSN, both my dogs get a Cosequin type or Cosequin DS tab, or in his case 2 tabs. He's got osteoarthritis, moderate dysplasia. We've had him about not quite a year. He's one of the Taiwan dogs.
Oh,
and
congratulations.
oh, thank you. Well, there's others here. And thanks. Human understanding that, you know, the standards, or there are none really, you know, they're not regulated. What's your thought, and maybe everyone else in the room knows the answer to this and I don't, in giving human over-the-counter glucosamine, chondroitin, and MSN to dogs? When I say human, not specifically marketed to the veterinary.
Right. Well, you're running into the same
Just the
quality
same things,
control
okay.
stuff. It wouldn't be harmful unless, you know,
Right.
there's an amount in there that may not be safe for a dog, but
Right.
that's rarely going to be the case. It's just going to be quality.
It's just going to be quality.
Yeah.
So it really, what you're saying is you're taking a bit of a gamble, but unless you truly do your homework and can find a product that for some reason has been above and beyond tested. So what you're saying is, you know, I could buy the Costco human brand versus the Cosequin, I can buy at Costco, as long as it was relatively equivalent.
True,
Right.
but the Cosequin you buy at Costco is a Nutramax product.
That's
Has
what
been
I thought
tested.
you were going to tell me, so I think I'm going to stick with that.
And if you want.
The price is not bad either.
Right, at Costco,
Yeah,
for sure,
yeah, okay.
And some of the human ones, unlike
you.
the animal ones, are USP rated or have the USP designation, which gives you a little bit more confidence
It does.
maybe about
It
the
does.
efficacy, but it doesn't speak to the bioavailability.
Right.
Right, and I'd feel better if you were gonna use a human form, if you at least got the USP certified ones. But yeah, the bioavailability is still, you know, hasn't been tested in the animal's digestive tract, which is different than ours.
So there's one other consideration with human supplements, and that is where it's manufactured. If it's manufactured in Germany, then you know it is actually regulated and tested. So there's no other country in the world that does it except Germany.
And there's supplements from all over the place, and what is in some of them, scary stuff.
I'm going to stick with the
Yeah. Any other questions about supplements while we're on the subject? All right. So, okay, I was about to step up on my weight control still box. It's free. It's pretty much the best medicine that you can provide for your aging dog, preferably before we get to an extreme mobility problem, because once their mobility really starts to suffer, it's harder to get them to move and harder to get them to lose the weight. So I really start to talk to my patients, both on the rehab side and the general practice side, early, that hey, we're getting in towards the earlier or the golden years. Not necessarily golden years, but and so now's a good time to trim her up. let's do it now. It's going to save you money on supplements and Rimadyl and blood work for Rimadyl, and because fat tissue is actually pro-inflammatory. It has chemicals that actually drive inflammation in the body. Not to mention the physics of carrying around more weight. That accelerates degenerative joint disease. And it makes moving around harder. Yeah.
How do we, as dog owners, check our dogs to find out, are they just right? Are they too over, are they carrying too much weight?
Good question.
How do we check?
Yeah, good question. I mean, in part, I feel it's my responsibility as a veterinarian to be giving you that information on your yearly exams, bi-yearly exams, giving you a body condition score, and also offering to calculate the kcals per day to reach a certain body weight, which I would project as being ideal, in which you try to stick to that kcal per day, and along with a physical activity recommendation, and offer weigh-ins. So in part that your vet should be on that. Taking it upon yourself, you can go to websites and look up, I know whether it's a bad word for you or not, Purina has a pretty good website that has body condition scoring. It's more about their silhouette and how they feel between your hands than it is a concrete number, because just like with people, there's different frames, different muscling, and so a body condition score of 5 out of 9, which is considered ideal, you're going to be able to feel ribs, you're going to be able to feel the backbone. It's not going to feel like this severe. They're going to have a waist, as you look at them on the side, a waist from underneath. Their beautiful feathers sometimes get in the way of appreciating that, so you actually have to touch them and look for that dip up towards their flank. And from above, and standing above them, you want to see ribs and a little indentation to the hips, and then feeling around their tail base for any squishiness that shouldn't be there. And so you should be able to feel ribs, and that's a good place to start, but definitely popping in and asking your veterinarian, or even a lot of vets are training their techs to do body condition score assessments. You might be able to check in with a tech and say, hey, can you give me a quick body condition score assessment so that I have a rough idea of where I'm at and where I can go.
I have a friend who's raising a guide dog puppy, and she's co-raising with another person. And the other person, she told the other raiser, well, I think that the dog's, getting too heavy. And the lady's going, oh, I can feel the ribs.
If you work hard enough, you can feel anybody's ribs pretty much.
Right. So, feeling ribs, what do you feel for? How?
Feeling the ribs, we want to feel it not like this again, but more a gentle bump. Underneath a very light fat covering. For instance, I can feel, let's feel him or her.
Okay.
Can I have him stand?
Yeah, right then. Now that I'm all in.
What's his name?
Ryan.
Oh, this is Ryan.
This is
I
Ryan.
heard about Ryan.
He has a big
So Ryan's a 5. If you want to feel perfect,
There you go. Good job.
he's perfect.
Yeah.
I would love all my patients to be Ryan.
So 5 is the best, and then 9 is,
9 is morbidly obese.
so would a 4 be like kind of on the thin side then?
4 would be on the thin side, but if it's a healthy thin, I'd rather have a 4 than a 9 any day.
I'm
I'd
just
rather have a
curious.
4 than a 7
Yeah.
or a 6.
I'm really thin, golden.
And he's probably gonna have degenerative joint disease way later on in
Yeah.
life, which will be awesome.
He'll live forever.
Yep.
Yeah. Okay.
So, okay, well, any other questions about weight control and body condition scoring? Okay. All right. Keeping them moving. I mean, everybody's heard the kind of cliche thing, you don't use it, you lose it. Well, it's true for dogs too. There's a real wicked downward spiral or slippery slope with a dog that starts to get achy, but isn't screaming out in pain. I don't think he's in pain. But he's just starting to maybe lag on his walks, maybe starting to lay around more. The more they lay around, the more they let you dictate their walks, the more pain they're in that you maybe haven't been educated enough to recognize, or somebody else hasn't picked up, the weaker the muscles get, the tighter the muscles get, the more dysfunctional their mobility is, and then they can't exercise, and then they get weaker, and then their bones get weaker, their ligaments get weaker, and so it's a real slippery slope. And so I encourage my seniors to stay active. Sometimes that requires addressing pain first. If I get somebody who's in a lot of pain and who's also maybe overweight, and admittedly the owner says, he doesn't feel like going for walks, so we don't. I start with the pain control because nobody wants to move when they're in a lot of pain. And in physiotherapy, we have the ability to work through some of that pain using the underwater treadmill, because you can take a dog who has some pretty painful joints, put them in the treadmill, take 60% of their body weight off their joints, put them in warm water with compression, and they can exercise better. It helps you get the ball rolling. And most of our senior dogs that come in for treadmill just to start getting the ball rolling, a lot of them stick with it because they just do so well. But yeah, we got to keep them moving, get them moving and keep them moving. Environment and modification of mobility aids, ramps, restricting stairs, slings and harnesses if needed. That's kind of more end stage, but I want to keep these guys from secondary injury. That's what we can control. We can't control some of the degenerative processes with aging, but we can control some of their environment. Traction, every day, multiple times a day, I'm having traction conversations. Nobody really likes to put random area treatment rugs all over their beautiful hardwood floors. Because it's not what you wanted when you got those floors, but that's really the only indoor traction option. I mean, I've had clients go through booties and nail caps and stuff that you glue on their feet and stuff you spray on their feet and everything. But really what works is area treatment rugs with backing or yoga mats. And so these guys really struggle on hardwood floors a lot of the time, especially as they start to lose their ability to keep their legs underneath them. Those are some of the earliest muscles to weaken in these guys, especially with hip degenerative joint disease. And so they splay and they're fighting to get up, and then they torque their back, and now they're in another type of spiral. So I would encourage you to either do some shopping for a really sweet set of matching area treatment rugs that you might be able to enjoy as well, or just like bullet and put them down for your buddy, or keep them out of certain areas of the house that maybe you want to not have area treatments in, or maybe they get this other area of the house where they can move about freely without getting themselves in trouble. Okay, here comes soapbox number 2. Short nails. Yes.
I just, backing up just a little bit, you had on here stair restriction.
Yeah.
Now, years ago, we had a dog that was recovering from total hip replacement, I think, correct me if I'm wrong, Bill. And we took him over to people that were thinking about adopting. And they had this, like, 50 stairs down to their house. And I thought, oh, this is great exercise. And we went back to Dr. Munjar, and he said, no. Is that a general thing, that stairs really aren't a good thing to exercise a dog on?
No, absolutely not. That is not a general thing.
Okay.
It's if necessary, if dogs are going to demonstrate that they might slip and fall, especially post-op dogs. That's, I think, what Dr. Munjar was probably really, in that phase harping on. But I use stairs in physiotherapy for strength maintenance and strength building after post-operative situations. But when you have stairs, especially slippery stairs with no traction on them, and you've got a dog who maybe they don't quite know where their feet are as well as they used to, and they still think that they've got this body that can fly up and down the stairs like they did when they were 4, it's a potential for some secondary injury that we may be able to intervene in. Either they, if they have problems with the stairs, I want them to do the stairs as long as they can. But when you start to sense that we might be starting to have a problem, or if it's post-op, then accompanied stairs using a sling or a harness system. There's lots of different harness systems out there. We use a lot of the Help 'em Up system. It's a really good system that has a front and back to it, so good for lifting them up off the ground, lifting them into the car. But the stairs can be a real hazard. Sometimes we talk about baby gating stairs, or if they have stairs access to stairs when you're not around, and they could potentially hurt themselves, and then we gotta maybe just restrict their access. Yeah.
His issue really wasn't, that's Dr. Munjar, his issue really wasn't going upstairs, because he has told us to use stairs to build up the post-op dog's muscles. These people wanted to throw a ball down the stairs, so the dog is charging down the stairs, and he said, a dog is so excited running after the ball or the stick or whatever, they're not paying attention where their feet are going.
Great idea for any dog.
Yeah, so, and same with frisbee throwing. He doesn't like dogs jumping up in the air to catch a frisbee.
It keeps orthopods in business.
Exactly, he's
being really honest, that is a dog thing. Some dogs just have to go airborne for frisbees, and if they can do that when they're a younger dog, before they start to develop osteoarthritis, which will probably develop it sooner, because they have all those concussive forces, much like gymnasts, they can do that, but I wouldn't be promoting that for a dog that has had an ACL, PLO necessarily. Their physics are changed, and so those days are sometimes needing to be retired for some dogs. But yes.
I had one follow-up to that question, which is when you're talking about the stair injuries, you're talking about injuries where it's a hip injury from the stairs themselves, or a dog just simply losing it and then tumbling down the stairs, or both.
Yeah. Not necessarily hip injury from the stairs. These are just stairs that might be slippery or a little bit too much relative to their zest for wanting to go up the stairs. It's, if you've got a guy who is navigating stairs and does it nice and slow and has never really shown a problem, then it's not something that I would restrict. You just keep one eye, one ear on them as they age and negotiating those stairs. And if they're starting to, just going down the stairs, tripping, and you're like, whoa, that could have been ugly. And what are they doing when you're not home? And what would happen if they do take a tumble down the stairs? There's a lot of spinal ramifications of that. So I know that there's a lot of stairs in a lot of people's houses, and I think the first thing I would do is put traction on them, and keep the nails short, and really just keep an eye on them, and start to notice when they're starting to misstep, or they paw up and they clip the step, and that just tells you that they're not quite negotiating them like they used to, and there could be some potential for injury. Back to the nail trimming. So important. It's dreaded. Nobody really loves getting their nails done if you're a dog. Nobody loves doing nails if you're a dog guardian. But it's so important. Traction. Slippery ends of your toes, especially if you're scrambling on a wooden floor. You heard it. It does not help. And then, on that note, the cute hair that comes in between their pads, that's long enough to cover their pads, which is their traction. Easy enough to zip off there. That's like walking on socks. So those are two really simple, maybe not so simple, but very important things to do. And then the biomechanics that come about with long nails. In rehab training, they liken it to us walking around on our heels. And if you do that for long enough, you're torquing your back, you're really changing the biodynamics. You can't propel. And so it doesn't help their mobility in the least to have long nails. And so I've made that kind of my mission, is to maybe over-educate people on nails, because I think it's really overlooked and underappreciated how important that is, especially as they're getting older, but for everybody. Puppies get the nail talk, so that we can try to condition them so that it's not such a big deal, all the way up to, guys getting up there, so. All right, I'll get off that one. Okay, common physiotherapy modalities we use with the senior geriatric patients, whether it be in prehab, where we do Somebody is looking at a hip replacement, much like Dottie. Going into it, especially if you're, under-exercised, overweight, or an aged creature, going into a surgery week makes recovery on the other end more difficult. Difficult on them, difficult on you, your own body. Taking a dog that, Dottie's position, she had one not leg, nub, and then another now bad leg, and so we used the help them up harness and some wheels to help, but going in strong is just a lot easier on everybody. So we'll do some prehab for these guys, which is just strengthening. A lot of times it includes underwater treadmill and some therapy exercises, home exercises. And in post-op rehab, we use a lot of the same things. Again, with our older set, we're dealing with a lot of osteoarthritis, sometimes some balance issues, some conscious proprioception, which is how your brain senses where your body parts are in space and how it adjusts to gravity. We use the treadmill a lot for those guys, for all of the benefits of the warm water and the compression, for soothing joints, for increasing circulation, moving lymphatics, taking off the pressure of some achy joints by using buoyancy, and then using the water hydrostatic pressure and their need to pull against it for muscle strengthening and to increase range of motion, because they have to walk in an exaggerated way to break that the water resistance to take the next step. We also use it for gait normalization. It kind of slows them down and they have to place their feet, and they relearn how to gait in the underwater treadmill. Therapy exercises, as I mentioned, we kind of shorten it to Therax. That's where we will have these guys in and do some targeted exercises with them. It might be exercises that would be more advanced than what I would assign somebody to do at home with their home exercises or home ex. But we will work with them in our clinic using tools that we have and training that we have to for some targeted strengthening or flexibility work, conscious proprioception work. And then everybody gets home exercises targeted to the ability of the owner, the ability and personality of the creature. The electrical stimulation, we've got that ability that we'll use combating pain, sometimes used in trying to regain muscle mass by exercising muscles that can't quite exercise yet, causing stimulation of those muscles for contraction. Cold laser, using a specific wavelength of light that's been shown to accelerate healing and influence pain chemicals in the body. Acupuncture, acupressure, fair bit of acupuncture on seniors and non-seniors for maintenance and post-op. Cryotherapy, heat and cold, and massage. I'm a big believer in massage for everybody. It's good for circulation and immune lymphatic flow, especially a dog if they are more sedentary or are post-op and aren't able to move around and have their own lymphatics work as they should. Helps in muscle flexibility, and if you're doing massage on your own creature at home, it's also good surveillance. You're going to come across bumps and painful spots that you wouldn't probably have ever found earlier because you're going over them on a regular basis. It's really good for bonding. I think there's a special connection that happens between you and your dog when you're massaging, and I think it's good for both parties. And there's certified animal massage therapists all over. There are folks that, in this area, they're likely to have been trained by the Northwest School of Animal Massage. They'll visit the home. A lot of them will also hold classes on basic pet owner massage that you can do at home. Around here, we use heel animal massage therapy, and we have a lot of co-patients with them, and it's a beautiful relationship for us because we also kind of have eyes out there that can, alert us to things that may have arisen since the last time I've seen them, or things that they've noticed that the owners may not have noticed. So That's kind of the end of my spiel. Did you have questions?
Yeah, your assistants that are standing there very quietly, right, but what are their duties and responsibilities there in helping you in your office? What do they do?
They run the place.
Yeah.
I've got the brains, but they run the place. Actually, they've got the brains too.
Yeah.
In a different way.
Good catch.
A lot of times
Yeah.
with the therapy exercises, a lot of that and a lot of the underwater treadmill is administered by Shauna and I. Dr. Shannon will write up a prescription and usually observe the first session, and then we administer the treatment. We work with the dog. We're the ones down on the floor doing the stretches, getting the peanut butter smeared on the pants, that kind of thing, keeping the doctor clean, and then we report back and we have discussions with her of, I noticed this muscle was tight today. Can you give me an exercise to work on that next week? Or, you know, this, we take a video of the underwater treadmill. This is what his gait's looking like this week. What additional challenges would you like us to give them? So we're kind of her hands through the clinic. She's the overseer. She works up the treatment. She sees what the issues are, and then we administer the treatments and report back to her. We're also, if you're ever calling us, we're the ones who answer the phones. We're the ones who do the emails. We do a lot of the paperwork side of it.
She's not doing too much, is she then?
She's got the magic eyes is the main difference. She's got the eyes to look at the gate and say, I see this thing. We're still
the
learning
fingers.
that.
Don't
The
forget
magic eyes, the magic fingers, correct. Yes, sir.
Could you characterize what the typical post-operative PT regimen is for maybe an post-orthopedic surgery, like a post-TPLO patient looks like?
Absolutely. Well, in real average, like blanket
Right.
speaking, because everybody's a
Right.
totally different story. If I see them right away, which I haven't yet, I think, done a good enough job educating the surgeons to let me put my hands on them as soon as I'd like them to, because they want nothing to be messed up. And if I had my way, I'd have my hands on them right away. And they'd be getting some laser to help speed the healing process. They'd be getting joint compressions. They might be getting some E-stim. There'd be education for the owner above and beyond what the surgeon has provided. They provide some good activity restriction usually, maybe some passive range of motion, but normally they don't get into joint compression. Joint compressions are simulating really gentle load on the joint to keep the mechanisms within the joint, the conscious proprioceptive mechanisms within the joint, from getting too scrambled, so to speak. When there's inflammation, when there's a lot of nerves and tissue cut through, the joint's communication to the rest of the nervous system and the rest of the body is disrupted. And the longer that goes on without loading the joint appropriately, the harder it is to get back. And so there are some things that you can do to absolutely take care of the surgery site in a very gentle way to start that process earlier than I usually get to get my hands on them. But by 8 weeks usually is when the surgeon feels pretty confident that they can come see me, and that'll usually involve some flexibility regaining. Most of these guys have shortened up, especially in the TPLO, they've shortened up in the hamstrings. They already have compensatory issues. Their spine is usually a mess because they've camped out on one leg and they're pulling themselves around at the front, and so I'm chasing those down. So a lot of what the owner gets in home exercises is front end work because we've got a lot of catching up to do by 8 weeks. It may include some weight shifting. A lot of these guys become habitual about not putting weight on their surgical leg, and they retain that habitual behavior for longer than they need to. So you have to remind or start to reacquaint them with weight shifting. So we do gentle things like as they're standing, we rock them onto their leg and back, and rock them onto their leg and back. Or we ask them to take cookies at specific angles that are going to make their body weight shift. For instance, if I'm a quadruped and I'm going to take a cookie over here, I have to weight shift back here to my surgical leg. And I'm getting cookies, so it's good. We try to keep it fun. So that's probably 8 weeks. We're doing a lot of chasing down compensatory issues, weight shifting, and trying to reacquaint them with using that leg. Usually by 12 weeks, we're well into strengthening, targeted, safe strengthening. That might include getting them to put their forelegs on something that's unstable, like we use a balance disc, and we'll show you this downstairs when you come downstairs. I'm going to show you a lot of what I'm talking about downstairs. To get their forelegs up on something unstable. So they're unstable, so they're going to rock their weight to the back. That's going to cause them to start to activate those muscles and build the quadriceps. Also, if you're using something unstable, their front end stabilizing muscles, their trunk, their core is having to work, so you're kind of getting an all over body benefit. I might be asking them, let's rewind to 8 weeks. Square sits. These guys have habitually, because before they get to their TPLO, they've had a torn CCL for a while, and so they sit like this, with their knee out. Yep. And we talk at the 8-week about square sitting. Anytime they go to sit, they get corrected, so that we have active range of motion. They lose flexion. And so that's a simple, just kind of like, okay, remember how to sit. This is, yeah, it kind of feels funny because you're tight, but this is what we're going to do with that. 12 weeks, we're talking about sit to stands, where we're doing dog squats. We may have already talked about strengthening the core in other ways, like doing doggy sit-ups. Core, I want to strengthen that to allow them to compensate better. And then also in general, a stronger core leads to a stronger spine. But we might also be asking them to do step overs, where it's another active range of motion, and another weight shifting or weight bearing exercise. They have to step over stuff. They have to bring one leg up and another, and they're guided over it slow, so they can't bunny hop over, which not all of them, but a lot of them want to do. They have to step over. That's going to encourage active hip and stifle as well as tarsal flexion, and they also have to weight bear momentarily to bring that other one up. So that's the sort of thing that we're talking about 12 weeks. 16 weeks, we're ramping up the strengthening. Usually we've gotten most of our range of motion back, and I gauge that by using this guy. The goniometer just gives me joint angles. Normally I'll take a goniometry measurement when they first come to me, see how deficient we are, and then at the recheck, which may be 4 or 6 weeks later, I'm measuring it again. Usually we're doing things right, we're getting closer to where we need to be, and we keep measuring until we're happy. And so by 16 weeks, usually we're